has one with her right now. Hey, Richelle.
Yeah, Mike, with almost every state in the country experiencing a flu outbreak, what are you in for when it comes to the flu? What are some ways to prevent it? Dr. John Hong with Cape Regional Medical Center in New Jersey joins us. Dr. Hong, when we talk about high levels in almost every state, what has that meant in your state, in New Jersey? What has that meant for you?
As an active primary care physician, I feel like I'm in the trenches with everyone. I would say I get interrupted every 15 minutes with a phone call because someone has the flu. Cape Regional Medical Center, just the urgent care and ER alone, getting at least 20 people coming in with the flu every day.
Are all the patients that are coming in, are they people that need to come in? Can some people actually weather this at home?
The majority of people can weather this at home. And in fact, we like people, if they can, weather at home, because otherwise you just spread it everywhere. I was just in someone's office today and someone was coughing all over all of us and I left the room. It's pretty bad. But if you have problems, especially if you have lung disease like cystic fibrosis or COPD or asthma, if you can't breathe, that makes sense. You better get to the emergency department.
So if you're high risk, absolutely don't try to wait it out. Go to the doctor.
Yes. If you're not sure, call your primary care physician, which is why it's so important to have a primary care physician, because otherwise people sometimes unnecessarily have to go to the emergency department because there's nowhere else to go. So we get a lot of calls saying, what should I do? And the main thing is, of course, hydrate, hydrate, hydrate. If you don't have high blood pressure, chicken noodle soup is the best thing in the world, but there is low sodium chicken noodle soup.
That's great advice. So obviously, if you're high risk or not, you should have gotten the flu shot for sure. Go ahead. You wanted to say something about that.
Oh, it's interesting because a few years ago, they looked at how many kids were getting vaccinated, and less than half the kids get vaccinated. A lot of people are against the flu shot, and a lot of people think that, A, that they'll get the flu from it, or B, I mean, they're worried they're going to get different side effects from it. But in general, flu shots have been shown to save lives. Maybe not necessarily your life, but maybe someone you love who has diabetes, who has heart disease, who's on dialysis, or infants. And as we know, it's the children who are most likely to pass away from the flu, as well as our senior citizens.
Absolutely. The numbers that we've heard are that about 20 children have actually died from the flu this season. Are you optimistic that we're perhaps on the downside of this?
I'm not sure if we're on the downside of this or not. It's hard to know because usually the epidemic peaks around week 6 or 7. I think we're around weeks 5 or 6. Right now, in my practice, it seems to be increasing. This week was absolutely brutal.
So your advice is don't go to the doctor if you don't have to. And I would imagine you would say, just don't go to public places if you don't have to, because you're exposing other people.
Exactly. And, if you have people who are vulnerable in your house, stay away from them. Put on a mask. Make sure you wash your hands. You don't want to contaminate other people. But I think we're in such a rush, push society. We think, oh, we have to come there. But then everyone says, get out of here. You're infected.
That's great advice. Dr. Hong, I hope you're able to get a bit of a break. I know your patients need you, but I hope you get a bit of a break as well. Dr. Hong, thank you. It's great advice.
Thank you.
All right.